Chapter 12. Ketamine. A few key facts. Yes, it really is a horse tranquilizer, but it's also got a lot of other uses. A synthetic substance developed as an anaesthetic in the 1960s, which is on the WHO's list of essential medicines. Ketamine is a depressant, specifically a dissociative anaesthetic. It's used in veterinary and human medicine, but also recreationally. It's consumed by snorting or occasionally smoking or injecting under the skin. It has a quick onset and intoxication can last a couple of hours. Some effects include a stimulating effect at low dose, mild psychedelic effects at a moderate dose, an impact on cognitive abilities, confusion, amnesia, and severe impact on movement at high doses. Ketamine hydrochloride is a synthetic dissociative anaesthetic. Those aren't necessarily words you hear together that often, so let's unpick this a bit. Synthetic means created by people rather than being extracted from something naturally occurring, usually a plant. Anesthetic is probably a word you're familiar with. These are drugs that numb parts of the body or cause a person to fall asleep, enabling medical procedures that would otherwise cause pain or discomfort to be conducted. But how is it dissociative? Dissociation is a feeling of being disconnected from your thoughts or feelings, or your sense of identity. Dissociative anesthetics do not necessarily lead a person to lose consciousness, but they induce an inability to move or feel. Ketamine is on the World Health Organization's list of essential medicines, and it's the most widely used anesthetic in veterinary medicine across the world. Colloquially, it's been known as the horse tranquilizer, but it's used with a variety of small and medium-sized mammals. But we're not here to talk about horses, though we will explore veterinary uses of K a little later in the chapter if you're interested. Recreationally, ketamine is usually consumed by snorting the substance as white crystalline powder, at lower doses than when it's used as an anaesthetic. However, it can also be injected, usually under the skin rather than into the bloodstream, or smoked. It's sometimes used in a club setting, but also for its psychedelic effects. What are the short-term effects? When ketamine is snorted, it gets into the bloodstream quickly, and because of this, the intoxication effects occur soon after it's taken. Although it's an anaesthetic, it has differing effects depending on the amount a person consumes, and at low doses it raises the heart rate and can, counterintuitively for an anaesthetic, make an individual feel more energised. Even in small amounts, ketamine can impact on a person's ability to speak properly and to perform some basic cognitive processes, such as spatial awareness and perception. A number of people I spoke to described ketamine intoxication as making things go a bit slanty. One person described feeling like the floor had become made of sponge cake and it was really difficult to walk through the cake. It's also associated with cognitive impairment during intoxication, including to speech and executive function, the brain functions involved in planning and executing complex tasks. Ketamine can cause amnesia and other memory problems. Ketamine intoxication can induce mild psychedelic effects, such as perceptual changes and psychotic-like experiences, which are appealing to some users but can also be distressing. Lucy described mini fireworks on things, like when you look into a kaleidoscope you get shimmery shapes, or when you see car headlights in a rearview mirror in the rain. Diffraction halos is the term she created to describe them. At slightly higher doses, users can experience a dissociative state, where their mind feels separated from their body. This can also manifest as a feeling of depersonalization, a sensation where a person's thoughts and feelings feel like they don't belong to themselves or that they belong to someone else, hence the dissociation in dissociative anesthetic. At higher doses still, the anesthetic quality of ketamine becomes more pronounced. People who have consumed these quantities may find it difficult to move and may feel that their limbs are heavy. They may also find their ability to feel pain is reduced and they might feel numb. At this level of intoxication, an individual can experience more vivid hallucinations. Some people describe what is known in some circles as the K-hole, where ability to move or speak is greatly impaired and the intoxication experience is directed inwards as a spiritual or Gnostic experience. People report intoxication experiences where they feel a heightened connection to the world, or out-of-body or near-death experiences that can be extremely rich in detail. The anesthetic property of ketamine is a particular risk for people who take ketamine recreationally. People consuming higher doses are vulnerable to assault from others while they are in this state, or they might put themselves in danger by not being aware of their surroundings. Being unaware they are outside and it's cold can lead to hypothermia, or being unaware of their surroundings could lead to walking into traffic. When I used to live in Bristol, there was an apocryphal tale about a group of people who had taken ketamine, running around the city centre with a frying pan, asking passers-by to whack them over the head with it cartoon style. I think this is extremely unlikely to be true, but if it was, they certainly might not feel the pain that evening, although in the morning. But I don't mean to make light of this. I've also heard from other individuals who've been assaulted or raped and unable to resist due to their inability to move or their lack of full consciousness while on ketamine. If you are considering taking high doses of ketamine to experience the K-hole, it's extremely important to ensure you are in a safe place and that there is someone else present to look after you before you do so. Ketamine can become more dangerous still when mixed with other substances. Because of its anesthetic qualities, it's dangerous to use ketamine alongside depressants such as alcohol or opiates, as this can substantially increase the risk of passing out, stopping breathing, or choking on vomit. It's also important to avoid mixing ketamine and most allergy medication, antihistamines, as they can increase dizziness, drowsiness, confusion, and inability to concentrate. Despite these risks, ketamine is a drug that people often report using in combination with other drugs. In particular, people I spoke to told me they use ketamine to extend a psychedelic trip, or in combination with cocaine, although this is ill-advised as taking ketamine alongside stimulants can put extra pressure on the heart and also increase the risk of anxiety brought on by heightened arousal and can lead to symptoms such as palpitations. What are the longer-term effects? There are a growing number of anecdotal reports and case studies showing that heavy ketamine use is associated with bladder and urinary tract problems, in particular a type of ulcerative cystitis called ketamine-induced ulcerative cystitis. This is an extremely unpleasant disorder with symptoms including bladder pain, blood in urine, a constant need to urinate but often finding it difficult to go, pain such as burning when urinating, and needing to urinate throughout the night. Although the mechanism by which ketamine might cause these problems isn't well known, there is some evidence from case studies of heavy recreational ketamine users that daily use for prolonged periods of time might lead to a thickening of the bladder wall. Other evidence suggests that ketamine has a direct effect on the lining of the bladder. Heavy users sometimes report cloudy or bloody urine, pain when going to the toilet, and urge incontinence. Urinary problems are extremely rare in individuals who have been prescribed ketamine for medical reasons, but a growing problem in heavy recreational users. It's not only the bladder at risk from heavy ketamine use. There are also a number of reports of kidney dysfunction and what are referred to as K-cramps, extreme abdominal pain, that some have hypothesized may be linked to liver damage, although this is unclear at the moment. It becomes a vicious cycle as people then report using ketamine to numb the pain of these cramps. There is some evidence that prolonged heavy ketamine use is associated with memory problems. Interestingly, a small study of 18 ketamine users and 10 polydrug-using controls also found some evidence that semantic memory impairment seen in ketamine users may reverse if a person dramatically cuts down their use. This study tested individuals at baseline and then 3 or 4 years later on the same battery of tests. Over that time period, the average reduction in ketamine use in the study was 88%. However, the same study found little evidence that impairments to episodic memory and attention improved, and the same was true of reports of lingering perceptual distortions and subclinical schizophrenia-esque thoughts. As with many of these studies, it's difficult to know with certainty whether or not there were already pre-existing differences between those who use ketamine and those who choose not to. But the use of a control group who use other substances is an attempt to minimize this problem, as they are likely to be more similar to people who use ketamine than are people who don't use any substances. Ketamine appears to be dependence-forming to some heavy users, although this is hard to ascertain for certain as large-scale investigations have not been conducted. However, ketamine has a number of properties such as fast onset and short-lasting effect that are linked to risk of habit forming. It's also the case that tolerance to the drug can build up, meaning higher doses are required for regular or even infrequent user to get the same effect, which can then go on to increase the risk of bladder damage and perpetuate the vicious cycle of using ketamine to numb the pain that overuse of the drug itself is causing. Compulsive behaviour is also reported by some individuals that use ketamine, who have stated that they will keep taking it until their supply runs out. There are risks specific to injecting ketamine. If injecting under the muscle, this can lead to irritation and damage to the skin at the site of injection. Myths and misconceptions. Ketamine is a horse tranquilizer. This is pretty much true. It's an extremely useful anaesthetic in veterinary medicine for small and large animals, although it's not specifically a horse tranquilizer. The World Health Organization reports that ketamine is the most widely used veterinary anaesthetic across the globe. It's particularly useful in locations where people are trying to manage populations of feral animals. Because ketamine could be administered via injection under the muscle, it can be done so via a dart gun from a distance, or a needle through the bars of a cage, putting people at less risk of transmitted diseases such as rabies. Even in the UK, ketamine can be used to anaesthetise an angry cat through the bars of a cage, rather than risk handling the animal and getting scratched or bitten. However, it's important here to think about the difference between a tranquilizer and an anaesthetic. Tranquilizers or sedatives are useful to relax and becalm an animal, but don't necessarily knock the animal out or act to prevent it feeling pain the way an anaesthetic does. Because of ketamine's safety profile, it makes a good animal anaesthetic, and this is of particular importance to horses, as their size and fragility mean there are extra complications when knocking out a horse. You need to lie it down carefully, and if the horse is laid down for a long time, there is a risk that its body muscle can constrict its lungs. Horses' hearts also beat slowly in normal circumstances, so anaesthetics that further slow the heart rate are extremely dangerous. Rather than bringing a horse into a specialised surgery with equipment to allow anaesthesia by gas, ketamine can be used to anaesthetise a horse in the field, sometimes literally, or else at a clinic without full gas anaesthesia equipment. Ketamine's beneficial use here is probably why it became known as a horse tranquilizer, although apparently it's also extremely useful in camel surgery. And it's also useful in situations where it's challenging to weigh an animal to estimate the dose required for anaesthesia. Because it doesn't depress breathing or impact on heart rate, if the dose is slightly overestimated, this will not put the animal in undue danger. Ketamine has what's known as a large window of efficacy, meaning there is a lot of headroom in dosing before risking overdose. However, whether an individual veterinary surgery will use ketamine or not is quite variable. Veterinary medicine is less controlled than human medicine, meaning protocols vary across sites. Dr. Danny Chambers is a vet who has worked in a number of locations in North and South West England. He told me that in some practices, ketamine would be used very regularly, and in others hardly at all, although he doesn't recall working anywhere without ketamine on site. He also told me about the procedures and protocols that need to be followed in order to use ketamine, due to its use as a recreational drug. If he needs to take ketamine out to treat a horse, for example, he needs to sign it out and keep it in a locked case in his vehicle. If he uses any to treat an animal, this needs to be detailed when he signs it back in. When working out of hours, at the start and end of a shift, the ketamine on site must be weighed, and any use must be recorded to prevent any going missing. It's kept in a dangerous medicines locked cabinet. There are more legal regulations around the storage of drugs with abuse potential, such as ketamine and morphine, than there are around the drugs that the vets use for euthanasia. Although often the drugs are treated the same by individual practices, there's no legal obligation for them to do so. So this isn't a myth, it's true. Does ketamine have any medical uses? Ketamine was first synthesized in the early 1960s for human medical use. At the time, PCP was being used as an anaesthetic, but it had a pretty bad adverse event profile, so researchers were looking for a drug that was similar but with less unpleasant side effects. Ketamine was synthesized in the USA and was initially tested in the prison population there, where it was found to be more appropriate for use in humans than PCP. It was given approval by the FDA, the USA's Food and Drug Administration, in 1970, and one of its first wide usages was to US soldiers during the Vietnam War. Ketamine is extremely useful as an anaesthetic in locations where ventilation equipment isn't available. Although its slight psychedelic effects don't make it an ideal anaesthetic in general, it doesn't impact on breathing rates as much as other anaesthetics do, so it's extremely useful in the field or in locations where it's harder to access such equipment. Because it doesn't lower blood pressure, it's also useful as a pain medication, analgesic, in emergency trauma situations. Finally, because it can be injected rather than needing to be administered as a gas, it's more portable than many other anaesthetics, meaning it's often used by emergency services in order to stabilise a patient while they're brought into hospital. Although it's not fully understood why, it seems that children aren't likely to experience the hallucinations and delusions associated with ketamine that adults do. So it used to be popular in paediatric medicine as well. However, although ketamine was deemed less problematic than PCP in terms of side effects, it was still found to induce hallucinations, vivid dreams, and dysphoria, a feeling of unhappiness or unwellness, and so other anaesthetics are now preferred. That said, ketamine is still to this day an extremely widely used anaesthetic worldwide. The World Health Organization lists it as an essential medicine, and it's prescribed in low doses for the treatment of pain, particularly nerve pain, sometimes called neuropathic pain. It's used in palliative care and in treatment for chronic cancer pain, particularly for individuals who are no longer responding to conventional opioid pain treatment. Ketamine also has a further use in medical research. The impact that it can have on a person's state of mind has been likened to that seen in patients with schizophrenia. This includes not only the positive symptoms of schizophrenia, such as hallucinations and delusions, but also what are known as the negative symptoms, an inability to feel pleasure or withdrawal, and the cognitive impairments. Ketamine has been shown to lead to amnesia after consumption, and there's some evidence that it impacts spatial awareness. As such, researchers are looking to ketamine to try to understand what might cause schizophrenia. As yet, if anything, it has thrown up more questions than it's answered. But as we understand more about how ketamine impacts on the brain, this could also help us to understand what brain changes might lead to serious and impairing conditions like schizophrenia. What don't we know? There's some suggestion that ketamine could be effective for treatment-resistant depression, a notoriously difficult condition to treat, hence the name. A pilot study conducted in Oxford in 2014 gave 28 patients with severe treatment-resistant depression or bipolar disorder low doses of intravenous IV ketamine infusion of varying concentrations over a period of 3 weeks. The results were mixed, with 8 individuals responding well to the treatment for between 25 days and 24 weeks. However, 8 other people in the study didn't complete the treatment, either because they suffered adverse reactions to the infusion or because they were not experiencing any benefit and were becoming more anxious. In 2017, at the appositely named Black Dog Institute in Sydney, Australia, a randomised controlled trial of IV ketamine found it to be well tolerated and potentially effective in a group of elderly patients with treatment-resistant depression. Although again, it was a small-scale investigatory study, so cannot tell us too much about its effectiveness. More recently, Yale School of Medicine ran a study in collaboration with a pharmaceutical company to investigate the impact of a ketamine nasal spray on extremely severe depression. The study recruited 68 people deemed at imminent risk of suicide. The individuals were brought into hospital and given conventional antidepressants. As well as this, half were given a nasal spray containing esketamine, a ketamine derivative, and half were given a placebo nasal spray. The study found that depression symptoms were quickly reduced in the patients given esketamine compared to placebo, but any difference between groups had disappeared within a month. The authors suggest that ketamine could be very useful in reducing acute severe depression. Current pharmacological depression treatments such as SSRIs are notorious for the lag between beginning treatment and an impact on depression being felt, which can take a few weeks. If ketamine is effective in giving some respite to people suffering while other treatments can kick in, it could be really helpful and save lives. However, not all researchers are equally optimistic. Another study attempted to investigate the same question using nasal spray, but was forced to end prematurely as patients with treatment-resistant depression recruited into the study were unable to self-administer the doses required before losing coordination ability, and some showed poor tolerability to ketamine. The group also found a huge variation in the levels of ketamine and its metabolites in the blood of individuals who'd been administered the same dose. Having said that, esketamine nasal spray is now licensed in the USA for prescription for treatment-resistant depression. At the moment, it's marketed under the brand names Ketanest and Spravato, among others. Ketamine is also currently being investigated as a treatment for alcohol addiction by a team based in Exeter in the southwest of England, led by Professor Celia Morgan. The concept that ketamine could be used in this way is not a new one. Experiments were initially conducted in the 1980s in Russia, where individuals with severe alcohol dependence were given a dose of ketamine once a week for 3 weeks, alongside psychological therapy. These individuals were compared to a group who received only treatment as usual. After a year, 66% of the individuals given ketamine were still alcohol abstinent, while only 24% of the other group were. This study design wasn't ideal. Control participants were just given treatment as normal, meaning it was clear to both participants and the experimenters who was in which group. The new study, which is ongoing at the time I'm writing this, is recruiting individuals with problematic alcohol use who have made the decision to give up alcohol completely. They will be administering a placebo to the control group, and neither researchers nor participants will know which group they are in, known as a double-blind study. But why might ketamine improve depression and improve the chances of people trying to abstain from alcohol being able to do so? Animal studies in rats have suggested that perhaps ketamine might stimulate brain growth. Rats given ketamine were found to show increased levels of a protein called BDNF, brain-derived neurotrophic factor. This protein is implicated in the growth of neurons or brain cells. Whether this is the case for humans has yet to be established. However, some researchers believe that it is the intoxication effect itself that might be the mechanism by which ketamine has these potential benefits. This theory became particularly prominent after other compounds that were very similar to ketamine but without a psychoactive element were successfully trialled in animals but did not produce the desired results in human trials. Perhaps there's something about the mystical intoxication effect that is important. This is also something that's been proposed as to why psychedelics, such as magic mushrooms and LSD, might be useful as a treatment for depression. We're a long way from knowing whether this is the case, but it's one possible explanation for potentially yet another effect of this often misunderstood substance.